Today we're talking about orthopedic reconstruction. So let me introduce you to Dr. Julie Shaner. She's the orthopedic surgeon at UF Health Jax. Thanks for having me.
Thank you for having me.
Of course. Let's talk about what orthopedic reconstruction surgery involves.
Sure. Reconstruction is actually pretty fancy terminology. Simply, it refers to having joint replacement done, hip or knee surgery, and or revision hip or knee surgery. So surgeries that often need to be redone.
And so who would be a good candidate for those types?
Good candidates for joint replacement surgery initially are individuals who've had long-standing arthritis, who've tried other treatments initially, and unfortunately, for better or for worse, have at some point failed to continue to have any further relief of their symptoms from conservative treatments like medications, therapy, bracing, among many others.
And so surgery doesn't necessarily have to be the end-all be-all, right?
It doesn't. Some folks decide they never want to have a surgery and can choose to live with the pain and disability of arthritis, which not many of us do in this age, but it is an option. But for those of us who wish to continue to remain active and I wouldn't say pain-free, but pain improved.
Manageable.
It's a very wonderful alternative.
Okay, talk about locations if somebody is interested in doing this.
We currently are at a multitude of sites. We are at UF Main downtown on 8th Street. We also are up at the North Hospital out by the airport, and recently we have moved towards the beaches, so we're also at JTB in Kernan, which is a joint venture with the Jax Spine and Pain team. So we're extending our capabilities to a greater variety of folks. And
touch on the direction that the service is headed.
Sure. I mean, the joint replacement program, I'm very hopeful that our goal is to try to grow in faculty. So we are actively recruiting more faculty to continue to do joint replacements, as well as grow in volume of patients that we're able to serve. And in doing so, like I mentioned, we're also expanding our geographic footprint and hoping to reach more individuals.
Yes, and so if somebody is interested in learning more, or maybe they think, okay, yeah, I'm ready to improve my life, whether it be improving the pain or just improving, being more active, what do you recommend they do?
I recommend they come visit us and have a lengthy discussion about, their various options and see where they're at so that we can meet them in the middle and come up with a patient-specific plan. And if that includes joint replacement, then so be it. We can talk to them about surgery and what to expect moving forward.
Yeah, because everybody's different. Everybody has a different situation, and so you got to tailor it to them. Just because maybe they have a friend or a family member who went through this, they might be going through something completely different.
We take each and every patient's scenario and we individualize it and talk to them about, what joint replacement is expected to bring to them and or what non-operative treatments would potentially work for them, as well as how the benefits and risks of surgery may or may not be different for them compared to other individuals.
Okay, wonderful. Well, thank you so much for telling us about this today and helping so many people and expanding. I love that too.
Thank you.
Of course. And if you'd like to see this interview again, you can head to our website as well.